So looking at his labs, he's got a BUN of 42, a creatinine of 1.8, creatinine clearance of 64, ASO titer is elevated, IVP shows enlarged kidneys. So looking at this, it's just kind of saying the kidneys aren't able to filter well because of the glomerulonephritis. The ASO titer shows positive for streptococcus, so he does have the strep throat infection, or he had the antibodies against the strep throat. So that could be the reason why he has glomerulonephritis. So what things with glomerulonephritis do you guys expect the doctor to order?
Would he order dialysis? Is it bad or not yet?
Depending on, like, you would probably look at his potassium levels.
Okay,
So
more blood work before you do that.
You'd expect him, like, on bed rest, definitely. Because if you don't put this patient on bed rest immediately, if you, like, get him up and walking around, it could tip him into acute renal failure because they're not able to sustain, like, they've got this high blood pressure already, and so they're not able to filter out the blood like it needs to. You're going to want him on strict INO. And so if your patient is oliguric, do you guys understand what oliguric is? Just like
A lot of urine.
a little bit of urine. Polyuria is a lot of urine. Yep. So oliguric means just a little bit of urine. So like 100 to 400 mils per day is a oliguria. So if they have oliguria, you're going to want to put them on fluid restrictions. So you'd put their urine output plus 500. So like if your patient is urinating 100 per day, then you can let them have like a fluid restriction of like 600 milliliters per day. So why would we put a patient like this on protein restrictions? Because doesn't protein help rebuild? What's a byproduct of protein?
Creatinine and BUN.
Good. So if we give them more protein and their kidneys aren't able to filter out that BUN and creatinine, it's not going to help it. Yeah.
Okay. Would they give like a diuretic to help them pee more?
Well, not necessarily because their kidneys can't filter out the stuff anyways.
So it's not going to give it even if there was a diuretic?
Yeah.
Okay.
They might give them like some beta blockers or calcium channel blockers to lower their blood pressure though.
Okay.
You're going to also want to get them on sodium restrictions, but if their sodium's already low, why would we also restrict sodium? Do you guys know? Because this is like dilutional hyponatremia. It's just because all of the kidneys can't filter out the water, so it's just diluting out all of the sodium. And if we give them more sodium, it's going to spike their blood pressure even more. So.
I have a question. So I don't know if this even like happens, but so like for the BUN to creatinine ratio, so if it was like 20 to 2, like would that still be like normal or fine? It's just like if one of them's raise or decrease and the other one isn't?
Yeah, it's just saying like what the normal levels are in the body. So like the 20 to 2, that would be 10 to 1. It would be the same thing.
Oh.
Yeah.